Okay, so we're going to be using Uniclick syringe with the Dysport. So we've diluted 3.3 mLs in a vial of Dysport, a 500 unit vial. That's going to give us about 3 units per click. Approximate equivalent to Botox is 3 units of Dysport. 3 units of Dysport to 1 unit of Botox. And on Combinator, we'll use about 15 units in a brow, approximately 45 units in her glabella. This is the glabella area here. And then in a crow's feet, we'll use about 18 units each side. So that amounts to about 96 units in total. And we'll draw it up using the Uniclick syringe. So 96 units divided by 3 will give us 32, and in each Uniclick syringe you get 25 clicks. So we'd use 2 syringes. Okay, so using the HexiGuard preparation wipes, we're just going to clean any excess makeup off. The HexiGuard preparation wipes has antiseptic, so it makes the injection sites aseptic and prevents any introduction of bacteria into our sites of injection. We'll use our A4H marking oil to inject. It's a lot better than using your traditional eyeliner to mark the sites, because you can inject in the site of injection. So we'll give it 1 click, and then you lift your brow. So we go and we look at the forehead, and we see if we want to resolve these excess lines. You don't want to go too low, because you're going to hit your frontalis muscle and then you'll give the patient a brow drop. So we try and go slightly above the midsection of the forehead. We divide it up, and you've got your aponeurosis here of your frontalis. So you'll only put 1 unit in the center, and then we can flange out 1 high, 1 low, 1 high, 1 low, like that. Being careful not to put your marking in any obvious veins. Okay, so that'll be 1 high, 1 low, high. Okay, so we've got 1 2 3 4, 1 2 3 4. Okay, so that's our markings for the forehead. And then we're going to take off our S-tab of the Uniclick syringe, and then proceed to inject in our markings. So you can stabilize the syringe with your finger, and then just before you hit the bone, get into that muscle and just inject 1 unit, making sure you have your gauze, and then 1 unit, 1 unit. So every click is a single unit. Let's come closer. Nice and simple. Okay. We do the other side. 1 unit. 1 unit. 1 unit. Okay, so that's the forehead done. So our next area will be the glabella area that we do. So you've got your procerus muscle that runs here, and your 2 corrugator muscles that run on each side of the brow there. So what you want to do is you want to try and get to this procerus muscle, which runs quite deep, and in right in the center. We'll put our marking, and then with Dysport, because it spreads a bit more than your Botox, you'd want to go a little bit higher than you would normally go with your Botox. Okay, so we would go there, and then on the final tip of the frontalis and corrugator there, just a little bit higher, and we will proceed to put, so with Botox you would normally put 4 to 5 units in your procerus, yeah? So you times that by 3, and that will give you 15 units. You normally put 3 to 4 in your corrugator muscle mass, and so you times that by 3, that'll be 12. You normally put 2 units of Botox on the most lateral point, so that will be 6. Okay, so we're going to proceed to do that, bearing in mind that every click is equivalent to 3 units. The way we've titrated it, the clicks will be equivalent to Botox units, and it just makes it a lot easier. So you've got your area there, as deep as possible. 1, 2, 4, 5. Okay, and then proceed. It's not going to be enough using this syringe to do the next one, so I'll go onto the next syringe. And like I said, we've got to go a little bit higher, so in the mid part of the muscle, and we go 1, 2, 3, and just on the lateral edge, more superficial, we're going to go 1, 2, and then we'll repeat, do the same. Make a cross face for us. Let's see. Okay, relax. So we go a little bit higher. 1, 2, 3. Make sure we hold the top of the brow, just to help you locate the muscle and prevent it from. Okay, superficial. 1, 2. And then feet, we're going to mark our area. Just smile for us. Smile hard. You can look for any veins in the area of marking. So we'll go about just a little bit of a finger width away from the eye. We mark those areas. You can place it in three points. If you want to do a brow lift, you ask the patient to squeeze the eye, squeeze your eye, and you go in the most lateral point, top part of the Bucularis oculus. You would put 2 to 3 units in that point, but we'll talk about that at a later stage. Do you want a brow lift? Okay, so we'll just add a couple of units for the brow lift, and I'll do the same on the side. Okay, squeeze your eyes. There we go. Okay, 1, 3. Okay, so we marked our areas. Sometimes if the patient has a lot of lines underneath the eye, you can put half a unit just underneath the eye, but not more than that, because you can land up paralyzing the Bucularis oculi, which is then going to cause the eye to sag a little bit. So just be very cautious putting your toxin underneath the eye border. Okay, I'll show you exactly how to do that. So we're going to inject in our marked sites. We'll just put 1, 2 in there, 1, 2, and then just a single unit in here.